First of all, I want to thank everyone for coming. Our lives are very busy, and so I'm honored and thrilled to have all of you here listening. Um, I am a practitioner in Ardmore, Pennsylvania, outside of Philadelphia, and my name is Eric Bernstein. I have done virtually nothing but laser surgery my entire professional career, aside from some basic science research. That means almost 25 years. I've been doing nothing but laser. And I have never in my life been more excited than I am right now by the developments that I've seen in the office and that I'm sharing with you now, one of which is the Picoway laser. It really is a single solution for multiple aesthetic indications. I think the laser platform is really going to be the way of the future. And these are my disclosures. The reason the Picoway is so versatile and meets so many needs is that it's a 3 wavelength system. So in other words, it has 1064 nanometer, 532 nanometer, as well as 785 nanometer. And that means the Picoway treats a broad range of tattoo colors. Obviously, you can treat benign pigmented lesions. That's pretty easy to do with any picosecond domain laser. Acne scarring and wrinkles, I was fortunate enough, and tattoo removal to be involved in the FDA clinical trials that led to clearance for these indications. And I'll be talking about those later as well. The Picoway laser is FDA cleared for improving wrinkles, which are a major component of sun-damaged skin. And those wrinkles occur by abnormal remodeling of the collagen and elastic fibers that are present in normal skin. Picoway laser then comes and helps remodel that skin to more resemble the way it's supposed to look before the sun had its way with our skin. What about the evolution from nanosecond to picosecond? I think it was known fairly long ago that the nanosecond domain lasers had a pulse duration that was a little bit too short. But the technology really wasn't there to make a production picosecond domain laser until quite recently. And why is it important? Because picosecond domain lasers are believed to work with more of a photoacoustic effect, meaning more of a shock wave, less heating, less peripheral damage to the skin, and can break pigment into smaller particles and basically be more effective for treating tattoos. And that has been my clinical experience so far. And I've had a lot of experience actually with all the different aspects and wavelengths of the Picoway laser. Conventional fractional resurfacing, typically we'll look at, full ablative resurfacing kind of was a gold standard for treating photodamaged skin, but side effects are substantial there. So most of us moved away from full ablative resurfacing to fractional, non-ablative and ablative resurfacing. And those modalities served us well for a long period of time, but there were some issues, such as healing times. They were a little bit longer, difficulty treating dark skin or tan patients. And I think the market was ripe and we were ready for a laser that kind of addressed some of the shortcomings of the previous generation ablative and non-ablative resurfacing fractionated lasers. So the Picoway has a very high peak power and the shortest pulse durations of any laser in the market now. And what does that mean? That means we're confining that energy to a very, very short period of time, which means more photoacoustic effect and less thermal damage. If you look at this graph here, you'll see a 5 nanosecond pulse compared to a 750 and then a 450 picosecond domain pulse. And in fact, some of the other wavelengths I'll show you in a second have even shorter pulse durations. So as you can see here, there are 3 true picosecond domain wavelengths in the Picoway. 1064 has a 450 picosecond pulse duration, 532 has a 375 picosecond pulse duration, and the 785 nanometer handpiece, which is the first ever titanium sapphire laser used in skin, has a 300 picosecond domain pulse duration, which is extremely short. And this means confinement of the energy. So we see here looking at controlled 50 nanosecond, 2 nanosecond, and 450 picosecond treatments of tribal black pigment in a cuvette. And you can see that the pigment is broken up more effectively by the 450 picosecond domain pulse, which is actually not surprising because the pulse duration is shorter. So, the energy has a much higher peak power. Here we see the Picoway Resolve, and it acts in the deeper epidermis and can act in the dermis to create photoacoustic injury. And what's really cool about the Resolve handpiece it's how precise the 101 tiny little focus beamlets are. Laser people, all of us should shoot our lasers on flash paper. It's kind of black paper used in the office to show what the laser beam looks like. And when you fire this laser on flash paper, the tremendous confinement of those beams is extremely impressive, which tells me that the little beamlets have extremely high peak powers, and it's very confined. If you look at other lasers in the past that make arrays of pinpoint beams, those beams are very highly focused. And so that's the objective of these picosecond domain lasers. And the engineers at Candela have beautifully accomplished that. In this next slide, I'm going to show a very cool video. And this video shows the Resolve handpiece firing in lucite, and it shows how the beam can focus beneath the surface. And that's due to the way the tiny little lenses inside the laser focus the laser beam. I love science pictures like that. So when I was talking about the flash paper, what we have here, I'm not sure, this may even be a picture I took actually on my flash paper. So up top, you see the Picoway Resolve uniform array of 101 dots. I think it's kind of cool. It's a little dot in the center, but there's an array of 100 dots with one extra one right there in the center. But look how amazingly confined they are. And what that means, if you look at the graph to the left, is those have very high peak power deposition of energy. Below, we have another device that uses a micro lens array where you don't really see this fine confinement of the beam that we're trying to get, and which, earlier generation lasers that were not picosecond domain lasers were able to achieve. Because they were fiber lasers. This does it in a wholly unique way using a totally cool lens that is created in a piece of crystal. Other lasers are used to create these tiny little focus beams. I mean, the science is just awesome. I feel lucky and happy to be able to kind of participate in the early stages and help with the clinical development of this device. I'm going to talk a little bit about tattoo removal and clinical results. I was involved in the clinical trial investigating the 532 and 1064 nanometer Picoway laser for treating removing decorative tattoos. We treated 60 subjects, 23 males, 37 females. Fitzpatrick skin types 1 through 6. There were 3 sites with 75 tattoos treated. Subjects received up to 10 treatments at 2 to 10 treatment intervals. I'd just like to say 2-week intervals, very short in my office. And obviously, when you're testing a laser, getting clearance, etc., kind of on a fast track. But in my office, the soonest I'll treat patients at 2-month intervals. I think the longer interval you leave, the better clearance you get. So when you're comparing device per device, you really have to look at how many treatments did it take and what was the interval between treatments. The treatments were spaced very close together, then the number of treatments is really not that relevant. So look at these scientific papers the way we were taught to in medical school, with a critical eye. We had blinded reviewer assessment as a primary endpoint. 86% of treated tattoos had greater than 50% clearance after free treatments, which is a very nice result. I numbed all my patients, so I don't think they really had any discomfort except for when I was numbing the tattoo, but that's on me. Here we have a picture of one of the patients in my study, and his entire tattoo was too big as far as the study parameters. So what's really cool about this is we treated the top half but not the bottom half. So you can sort of see in the same picture the remnants of what was left of the tattoo and how the treated portion is mostly gone after 7 treatments. And again, these treatments were administered fairly close together in clinical practice. probably spread them apart a little bit more. Here we have a multicolored tattoo, but I want to point out it was only treated with the 1064 nanometer wavelength. In real life, you would use the 1064 nanometer to treat the black, but in this case, it was a clinical trial. We didn't do that. So we see that most of the black is gone after 3 treatments. After treatment 7, all you see that's really left is some of the purple and green, which actually I didn't expect to go away at all because we didn't use the 785, but here actually it looks like we've gotten that to resolve somewhat. Here in this next slide, I was actually the sole site for the 785 nanometer wavelength, which was the first laser of its type used in skin. It has extremely short pulse duration of 300 picoseconds. I treated 15 subjects with 22 tattoos, 18 were blue-green, and the treatments were administered at 6 to 16-week intervals. We used a 2 to 4 millimeter spot, and 83%, 15 of 18 of blue-green tattoos achieved at least 50% clearance compared to baseline after just 2 treatments. 100% of the pre and post-treatment tattoos were correctly identified by blinded reviewers. It's actually not that surprising because it works, so it's pretty obvious. Here we have an interesting patient. This tattoo was treated twice, and the blue came out but left the white behind. Generally, when you see light blue, that means there's white in there, which can turn gray. In this particular case, this is actually a very interesting tattoo. I was kind of pleasantly surprised by this result, and actually hope to explore this further with a study down the road. So here what we have is looking at after 4 treatments using only the 785 nanometer wavelength. Again, in real life, you're not going to treat this way. You're going to treat the black ink, right, with 1064. You're going to treat the reds and yellows with 532, and you're going to treat the blue and the green with 785. So these results are not surprising. They're only treated with 785. So obviously we got greater than 80% clearance of purple after 4 treatments. Looks like greater than 80% with blue, and it looks like around 70-some% with green after 4 treatments using the 785. Black actually cleared surprisingly well. I'm surprised by that at around 60%. Again, we wouldn't have used that wavelength. No surprise at all that a red laser doesn't take out red. Makes sense, right? Red reflects red away from your eye, so you wouldn't expect it to work on the red and yellow. So what this says is things performed, and the reviewers that rated the pictures rated them the way, and they came out the way we would expect, which is cool. For treating benign pigmented lesions, obviously nanosecond and picosecond domain lasers do a beautiful job removing pigment. Pigment's pigmented. It's darker, so that means it absorbs light, and that makes pigmented things pretty easy to treat. But treating them without post-inflammatory hyperpigmentation and making it look good isn't always easy, and it worked beautifully here. We have some pictures from Henry Chan, a tremendous laser expert from Hong Kong, showing clearance of pigmented lesions. Here again is another picture from Henry looking at melasma, 4 treatments of someone with melasma. I will say in one of the clinical trials we did, which we'll talk about soon, with the Resolve for treating wrinkles, one of the subjects had melasma and cleared nicely, like Henry's patient here, kind of raising a very important question about can and how well will these lasers work in treating melasma. So in treating wrinkles, clinical results, first thing I'd like to show is a treatment because it's really cool to see the laser in action. So here we have a video of a laser treatment in action, and you can see, because this is 1064, so the actual treatment beam's invisible, but you're seeing the reaction in the skin from each of the 101 treatment zones. You can beautifully see the grid appearing on the skin, which is kind of fun while you're treating. Get to see that. So, and there's a nice snap, and then you see kind of a reaction in the skin, and you can see tiny little, almost cayenne pepper like petechiae, no bleeding at all, just little petechiae at the treatment site. So the wrinkle study was done with the Resolve, looking at both the 532 nanometer and or 1064 nanometer Resolve handpiece. That means there are 2 handpieces emitting these 101 little dots of micro treatment zones at 532 and 1064 nanometers. What does that mean? That means you can use one or the other. You can mix and match. And I think we're going to learn a lot more going forward of the value of combining these 2 wavelengths and what that brings to the table. Because there is a slightly different clinical effect you can see using these two different handpieces. So in this study, there were 4 sites, myself, Ariel Kavar, Jerry Garden, Michael Gold. 72 patients were treated, 3 males, 69 females, on 92 facial areas. Mild to moderate bilateral perioral or periorbital wrinkles were treated, and the patients had skin types 1 through 4 that were entered into the study. So treatment 1 was done with a double pass of both 532 and 1064 at one of the sites. On my site, we did single wavelength treatments, either 1064 or 532. But I think that's one of the beautiful things about the versatility of this device. In this particular study where we're talking about using both wavelengths, topical anesthetic was applied, and 78%, the total of 369 treatments were performed without anesthesia. That's what we did. We didn't need any topical anesthesia. Patients didn't need it. And I think it made treatments go by much more quickly. I don't think it's at all necessary, at least the protocol that we used. And we did up to 6 treatment sessions were performed. So with the single pass 532 and 1064 or 1064, N of 72, 82% of treated areas showed improvement in wrinkles at final 12-week study visit after 3 to 6 treatment sessions. There was another one, single pass 532 and or 1064, N equals 72, same numbers. We saw 92% of treated areas showed improvement in wrinkles appearance at the final 12-week study endpoint. And finally, with the double pass 532 and 1064, that was one site with 20 subjects treated. 100% of treated areas showed improvement in the elastosis score at the final 12-week study visit. Moving on, obviously there was high satisfaction in wrinkle reduction since the objective measures showed satisfaction objectively. 88% investigators, which I don't know what that's worth. We're always happy, but subjects, 74% were happy at 12-week follow-up. Most patients reported low level of discomfort, basically a little over a 4 in a 0 to 10 scale. So side effects were typically erythema, and you can also see that little cayenne pepper-like petechiae I talked about, and a little bit of edema, but basically people can put on makeup right away and just boom, head out. So I basically tell my patients there's really little to no downtime. Here we have a patient treated baseline and 12-week follow-up with a 1064 nanometer laser treatment for wrinkles. That was after 5 treatments. Again, we have another one treated, again, 12-week follow-up. Next, there was a clinical trial on acne scars. One of the problems in my office treating acne scars is I haven't had a way to treat patients with darker skin types in a way that I'm comfortable with, that's reproducibly safe, reproducibly without increased pigmentation, and reliable. So I have been looking toward the Picoway for that in my office. And in this study, I can talk about patients that were enrolled. And again, during the Q&A, I have a great deal of experience subsequent to the study in my office using this device. I was the first one to use Picoway for tattoos and the Resolve handpieces and the 785 handpieces. And by first, I don't think it means I'm the smartest or best, but it does mean I've been doing it longer than anyone else. So I've had a longer time to learn, I guess, from what I've been doing. So acne scar study overview. There were 3 sites, myself, Ariel Kavar, and Jerry Garden. We had 36 male and female subjects with Fitzpatrick skin types 2 through 5, although I believe it was open to all Fitzpatrick skin types. So there was a 1064 study. Basically, 5 treatments were administered at 3 to 8 week intervals. The average was 4 treatments. I believe in our site we did 5, although the first treatment we administered was at a pretty low fluence because we had just started using the laser, and I think we started certainly below where I would start today. Here we have the results of the study showing 94% of the treated areas improved, following 3 to 4 treatments as evaluated by blinded evaluation of photographs. 89% investigator satisfaction. Again, the best measure to me is the objective measurement, the 94%, and 78% subject satisfaction. So I was very happy with the results of that study. The mild and transient treatment response for acne scars. No anesthetic was used in this trial. Most subjects reported mild levels of pain. We didn't see any adverse events. The typical responses you see, redness or erythema, edema. I wouldn't call it, says pinpoint bleeding, but what I saw, tiny little petechiae that, cayenne pepper look, but there's not really bleeding like onto the surface of the skin. They're little tiny petechiae. It says crusting. I really didn't see crusting. Acne breakouts, you can see, I think after any device treatment for any cause in acne-prone patients has been my experience. I tend to warn patients about that following any laser treatment. Here we have a subject this was from my site. This is 12-week follow-up after 4 treatments. Here we have there's another subject from our site again, the darker skin type, showing again nice improvement in acne scarring. In conclusion, Picoway really is a versatile platform. What does that mean? Well, the Picoway laser, because of its 3 wavelengths, treats a very broad range of colors. And to me, this is the state of the art, the device, both from an effectiveness standpoint, what you're going to see in the clinic, what you're going to see in your office, as well as from a marketing standpoint. We have FDA clearance. This laser is FDA cleared for acne scars and wrinkles. Very high peak power and the shortest pulse durations for maximal photoacoustic effect and treatment across a broad range of Fitzpatrick skin types. And again, I'm happy to talk about my experience in the office with this laser because I've had a much, much broader experience than was shown in this study. And very high patient satisfaction, little to no downtime, and I didn't use any topical anesthetic. So it is absolutely a go-to device in my office. I can tell you how I use it, often alone, often in combination with another device that sits right next to it, depending on the patient. But this is the Picoway is absolutely one of the most used devices in my office, and I'm happy to talk about it. I'm thrilled with the performance of the Picoway. Remove boldly and treat lightly. I think that is actually how it works. You get the device in, or you come and visit, and literally you talk to the patients. What'd you think? How'd you like the device? They will tell you. I've done studies in the past where it's a brand new device. We don't know what's going to happen. So we start at a very low energy, so low it's placebo. The second you hit the therapeutic place where that device is working, the patients notice. Patients know what works. It's amazing. So, ask them. You can ask my patients too. So I'm happy to answer any questions. This is the fun part. I'm also happy to hear any of your experiences, what you think. Basically, anything you want to talk about. Thank you very much for sticking with us. I know it's tough, particularly during a busy patient day.